I've been treating toilet infection for how many years now? Go and see. Hi guys. Today I am going to be talking about 5 things your obstetrician slash gynecologist, that is, women doctors, doctors who take care of women, want you to know. These are very important tips. And don't say this is a video for guys. You be married, you have sisters. So this video is also for you, dear man. Okay, let's go to the video. So yeah, welcome back to my channel. If you're new here, you're welcome. If you're a returning subscriber, thank you so much. You're the real MVP. So yeah, today I'm going to be giving you 5 things for free of charge, that your gynecologist slash your obstetrician, because here in Nigeria they are together, wants you to know. Okay, so let's get into the video. So yeah, this video was inspired by my friend and roommate Confidence of all. Yeah, Confi, thank you so much. Number one, your gynecologist and your obstetrician wants you to know as a woman your last menstrual period, which is the first day of the menstruation you saw last. Okay, whether pregnant or not pregnant. But this is particularly important for pregnant women, because they will use that time to judge the date of your pregnancy. Now, of course, ultrasound can also do this, but ultrasound is more accurate in early pregnancy. And okay, no, let me not say most. A lot of women in Nigeria don't register for antenatal on time. There's a certain belief that the antenatal is supposed to be registered for like 3 months. But actually, you should register for antenatal once you miss your period. That is the teaching. But because WHO understands our environment, they say between 8 weeks, from 8 weeks you should have registered. But please register for antenatal as soon as you miss your period, so that an early ultrasound scan can be done, which is most accurate for dating your pregnancy. Okay, but your LMP, your last menstrual period, is also very, very important. It's also important to know if your period is regular or not. Now I'm sure you're saying that I cannot remember it, too. I cannot remember it. Even me cannot remember it. That is why you should use apps. You have a smartphone, you have a tablet, use it and download apps. I'll put the one I use there. It's not sponsored, it's not like it's the best, but it's just the one I downloaded and that's the one I'm using. That way, even if I don't remember what the last day was, I'll just check the app. The only thing is that once your period starts, you just go and put it in the app. That's all. That way you know your last menstrual period. Remember that your last menstrual period means the first day of the last normal period that you saw. Okay? Fine. Number 2 is that there's actually family planning. You don't have to have 20 children. Of course, nobody wants to have 20 children. I'm exaggerating, but seriously, guys, there's this concept in Igbo land. Yes, the picture is that you see the woman carrying a toddler, or maybe there's a toddler, then she's breastfeeding one, and then she's pregnant. It's not good for you. As a woman, when you get pregnant, you're supposed to recover from the pregnancy for the next one. So there are various options for contraceptive for you. There's short term, there's long term, there's hormonal, there's non-hormonal, there's even the natural family planning for people who don't want to use anything in their body, or maybe your religion is against it or something like that. There's something for everybody. Talk to your gynecologist. They will explain everything to you, and then you will choose the one that is best suited for you, so that you don't have 20 children. Seriously, these are gone are the days when they used to kill goats for a woman when she has more than 10 children. This economy is hard. Nigeria is hard as it is. Please don't complicate matters by giving birth to plenty children. School fees is very expensive now. Pampers is expensive. Gone are the days of napkin. Baby food too is very expensive. So you can do your family planning. Don't be afraid. At least reach out first. Schedule an appointment and see them first before you decide that family planning is not for you. Even if you want to use the natural family planning, at least they'll be able to explain it better to you. If this is something you guys want me to make a video, tell me in the comment section. Okay? Number 3 I want to loud it. I want to shout it. Cesarean section is not abnormal delivery. This is what I mean. You, a woman has, okay, I'll give you a story so that you get where I'm coming from. A woman has had two cesarean sections, okay, and then this she's at her. I think she had four pregnancies and had the first two were vaginal birth, the second two were cesarean sections for different issues, and now she was pregnant again. On top of the fact that she had been pregnant for multiple times, this was her fifth pregnancy. She had had two cesarean sections. So once you've had two cesarean sections, there's no trial of labor anything for you again. You know that the third one is going to be a cesarean section. And then the woman came for antenatal and said that her mother said that that she can do vaginal delivery, that she's not going to go for CS. The consultant, I was a student then, the consultant counseled her, talked to her. This woman refused though, that she does not want to do a normal birth again. She does not want to do a normal birth again, that she wants to go through normal labor. This is the first story. Of course, that woman, you know, what pushes out the baby, those contractions that the women have, is actually the uterus doing like this. Now, the uterus already has a scar. That's the womb already has a scar. So, if it can and tear the scar, and that's it, you can lose both the mother and the baby. So the safest is for the woman to go through another cesarean section. But because we demonize cesarean sections, people now feel like, hey, if we dey go through CS is a bad thing. When I was catching baby, when I was a student in fifth year, so I met a woman. This was her third, right? No, her third delivery. She had one male, one female, so she had both sexes. Okay, so we're like, this has to be your last delivery. And then, she was just waiting. She was already booked. It was an elective. It was not like an emergency. She was already booked, just waiting for to be rolled into the theater. And then, of course, she was in the labor room. And then I noticed that her face was changing. So I went to her and I was like, "Madam, what's the problem?" She said, that she has never experienced labor, that she doesn't even know how it feels, that most women look at her as if she's not a woman. So what makes you a woman is labor pain. Please, let's stop demonizing cesarean sections. Please. It's not abnormal delivery. It's one of the ways that women can give birth. Abroad already, people opt for elective CS simply because they don't want to go through the pain of labor. So it is not abnormal. Please, brethren, it is not abnormal. Loud it everywhere. It is not abnormal. Okay? Number 3. No, this is number 4. Everything is not toilet infection. Ladies, 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 ladies. Everything is not toilet infection. God. You have been treating toilet infection for how many years now? Go and see your gynecologist too. And you are treating toilet infection for 10 years. What kind of toilet infection is that? See, but there's something we call pelvic inflammatory disease. It's an infection of the productive area of the woman, the womb, the tubes, the ovaries, all of that. Okay, so those things can actually lead to that infection can actually, if not properly treated, lead to infertility. Woman go marry, go fit give birth, they go talk say im tube don block because say infection was not treated the way it's supposed to be treated. So don't be treating toilet infection for 10 years. Please, please, please now. If you have all those symptoms that you call toilet infection symptoms, please go and see your gynecologist. They will do the proper tests and they will find out what the problem is and treat it adequately. How man can going from one place to another, and then IVF is very expensive to now go and harvest ovary and do it outside and then now implant it in the womb. And infertility is not a joke. Like, it's not a joke. It deals with it affects your emotions, it affects a lot of things. So if it's something that can be prevented, I'm not saying that every woman that has not been able to give birth has an infection problem. Please don't quote me wrong. That's not what I'm saying. There are many causes of why a man or a couple have not been able to have a baby, don't go and be looking at people as if they have infection and say that I'm the one that said I am not the one. But this is just one of the causes, and this is something that can be prevented. So if you have symptoms, please just go and see your gynecologist, please. Number 5 and the last thing is that there's actually preconceptional care. What do I mean? That a woman who is planning to get pregnant can actually get care before she gets pregnant. This is especially important for people who already have other illnesses that they are treating prior to getting pregnant. Maybe, for example, you have diabetes, you have hypertension, you have epilepsy, you're having convulsions, you have sickle cell, things like that. Don't spring pregnancy on your doctors that are already managing you, because some of these drugs have to be adjusted because they can affect the baby that is growing inside. So if you know you want to get pregnant, as everybody actually, if you know you want to get pregnant, you're supposed to be getting care. But particularly the people that have these illnesses already. So yeah, I've come to the end of this video. I hope you learned something. I don't know if you learned something, and please share it with all your female friends and all your male friends that are going to marry. I have I have a picture, and everybody that has a brother. Hey, Jesus. And everybody has a sister should actually watch this and be informed. Information, knowledge is power, okay? So yeah, if you enjoyed this video, please share it. If you also enjoyed it, if you enjoyed this video, you also enjoyed this one's up here. So yeah, thank you for watching to the end. I'm so grateful. Thank you so much, and I will see you in the next video. Bye.